Good afternoon, ladies and gentlemen who have joined us on this Dr. Fundi channel via multiple social media platforms, Facebook, YouTube, Twitter, Instagram, and also the Dr. Fundi website. My name is Fundi Lenyati. I'm the host on this channel. Today, we have an interesting guest, but before I introduce her, we are in the month of mental health awareness. Now, so for the rest of the October month, it's a period where we're supposed to increase awareness to the general public about issues that have to do with mental health. So there are many ways of doing that. One way is for me to sit here and actually just regurgitate information about what are the symptoms, how is it diagnosed, how is it treated, and all of those kind of things, which is easy to do. But what is most powerful is actually people sharing their stories about living with mental illness and how, in spite of the mental illness, they've still been able to be productive members of society. They have actually got jobs that are responsible jobs where they have to make major decisions, sometimes decisions of life and death. And the reason we're doing this is because at times people have ideas about mental illness, as if these are conditions that are not manageable. These are conditions that if you have them, then you can't do, certain jobs. And so today, my guest is Dr. Zimewezinkosi Nzimande. She has to tell us, that name is very, very long, Zimewezinkosi Nzimande. So she is our guest today. She qualified as a medical doctor in 2008. She did her internship 2009 to 2010. So when we were celebrating the World Cup in South Africa, she was just finishing her internship here in KZN. In 2011, she did her community service and did that successfully. And thereafter, she became a medical officer, meaning a doctor who has done the internship and community service, who is now, working usually in an area of her interest. And at the time, she had an interest to specialize in one of the medical fields. And all of a sudden, in 2012, she got sick. She was in coma for a couple of days, about 10 days. And afterwards, she was diagnosed with, a bipolar mood disorder. But she managed that condition. And between 2012 and 2014, she's been trying to juggle her work and also optimizing the management of her condition. And then in 2018, she actually got a job of being a clinical manager. She'll tell us what that entails. And then later on, early this year, she got another job to become a medical manager. She's based in Pietermaritzburg. So that's the introduction about Dr. Zimewezinkosi Nzimande. Dr. Nzimande, welcome to the Dr. Fundi platform.
Dokotela, it's Dr. Nzimande.
Nzimande, uyabona bona Nzimande labo Nkabinde cishe kufane man, I'm sorry about that. Dr. Zimewezinkosi Nzimande. All right, maybe bese ngikuganisa, komunye umuzi nje. Uyayibona? I'm sorry about that, Doc. Dr. Nzimande, not Nkabinde. All right, I'm sorry about that. Right. But anyway, besides that, is there anything else that is not factual? I've shared with you.
Okay. Zimewezinkosi Nzimande is from my grandmother.
Yeah.
It was actually it's just a Zime, and then they just put a capital Z out of it. It means
Yeah.
the most beautiful girl amongst the girls. So then
Yeah.
that's how my grandmother said that. It's not in my ID as Zimewezinkosi. It's Zime.
Yeah. Zime.
Nzimande.
Zimande.
Everything so far is straightforward. I did my internship in Kimberley.
Imancane dokotela sujaha. Ngwekazi yena ligama elikhona kwi-ID.
Oh no, actually in my ID there are 4 names.
Yeah.
I always say I was supposed to be the only child to my mother, and my brother came 6 years later.
Yeah. So they gave me 4 names.
In my ID, it's Zime, Yolisa, Ntandwenhle Lumko.
Yo, I know. Kushuthi wonke umuntu wayefuna nje ukunikeza igama ne. But anyway, before we start with our conversation, Doc, today I understand it's your birthday.
Yes,
and I'm not gonna say how many years. Normally, it's rude to mention age yomuntu wesifazane. Yeah, but so all we'll say is that it's your birthday today, and I'll do something that I've never done on this show, to sing a happy birthday, a song for you, hoping that will make up for whatever situation. So let me sing for you, but I don't think I'll go far with idols. So, but I will try.
Okay.
Happy birthday to you. Happy birthday to you. Happy birthday to you, Dr. Zime. Happy birthday to you. I'm not going to continue and say how old are you now. Now that one, I'm not going to do that. All right. So welcome to the Dr. Fundi channel, Dr. Zime.
Thank you.
All right. In my introduction, I actually shared the fact that this month it's mental health awareness month, and 2 days ago it was World Mental Awareness Day. Okay, now so for the rest of the month of October, we are supposed to be increasing awareness around issues of mental health. We are supposed to be dealing with issues relating to stigma, issues relating to discrimination of people who are living with mental illnesses. So, and there's no better way to deal with issues of social stigma than to get people who are living with the condition to actually share their stories, put their faces, and actually say to others who may still be struggling, or hiding themselves, to say it is possible to live a fulfilling life, even if you have a mental illness, because most often than not, mental illness is manageable. Obviously, there needs to be certain changes in one's lifestyle. If somebody used to drink a lot, they have to stop drinking, because that will work against their treatment. Also, there may be certain triggers that may actually worsen their condition, in which case they need to be aware of those triggers, so that by avoiding those triggers, then they don't have many relapses. So you have then agreed to share. In fact, earlier today, you made a video which you shared on your Facebook page, where you were actually sharing your journey with bipolar mood disorder with your followers. And as one of the people who is your follower on Facebook, I thought, being your birthday and you are sharing with the world, I might as well give you a bigger platform for you to actually share, within your level of comfort. Okay. So thank you for choosing to also share on this platform. We appreciate that, because it is through having people like you who are courageous who are bold, that we will be able to deal with some of the stigma, the discrimination, and sometimes even ignorance around issues of mental health. So thank you, thank you, thank you for choosing to be with us. So to kickstart this conversation, what I normally do for people who are darkies, I normally ask them ukuthi bashaye ithakazelo zabo. Uyazazi ithakazelo zabo zakho wedokotela?
Don't do that.
Your clan, do you know any of your clan names, Doc? Okay.
That's why Umangwekazi, one of his thakazelo. So there was a friend who used to always call me that, and I just find it very queenly to be called that.
Yeah.
I don't like umpepeta. I'm like my mother. I always like si perpetua in.
Hey.
So so we'll settle for Umangwekazi basically. But Umdluli, Umgwala, yes, umpepeta. But please don't ask me. I'm not good at it.
No. So you've done enough already. You've done enough already, Doc. But anyway, thank you for doing that. If there are some viewers who are also sharing the clan name with you, they can then connect with you like that, you know. All right, Doc. Let's start with the basics. Dr. Zime, where did she grow up? Where were you born and where did you grow up?
Mom says she gave birth to me in Durban.
Yes.
At that time, the family was living at Pateni, Richmond.
Yeah.
And she was working in Edendale Hospital, 1985.
Yes.
And then in 1993, we moved to Pietermaritzburg. Yes. And ever since then, I've been settled here.
Oh, so you are a PMB girl.
You can say that.
Okay, lovely,
Most
lovely.
of my memories, yeah.
All right. So you did your junior and your senior secondary education in La Poema Respect.
Yes, I did, and it all changed when I was in class 2. They discovered I had a hearing problem.
Yeah.
So the journey changed from being in a normal school or normal class. I went to what they call a partially hearing unit.
Yeah.
And from standard 1 to standard 4, I was in that class. Then they graduated me to a normal mainstream because they said it seemed like I can function so long as I have my hearing aid.
Yeah, lovely, lovely, lovely. So, Doc, growing up, what did you want to be? You know, we all have dreams. Kula, omunye ufuna ipoisa, omunye udokotela, omunye ufuna lawyer. What did you want to be growing up?
Dokotela, the truth is, I didn't know. The thing is, having partial hearing. Yeah. And coming into at home and your mother tells them, there was always this atmosphere of, will she make it? So then and really my mom went all out. I've been a girl who had braces, I've been a girl who had glasses, I had hearing aids, as in like as technology advances, she would make sure I get that. Yeah. So she didn't do it out of badness, but for me, I could sense because I had to work hard to prove that I can do it. Yeah. So high school was about finishing each year, and just doing it perfectly. That I didn't realize when I started doing first aid in grade 10. Yeah. I just love it. So I would do all the sports every weekend, only to get a recognition in matric for services. Yeah. But I still didn't know. So when we got that book, I can't remember what the book that we used to do for application for varsity. Yeah. I just said to my mom, I want to do anything that has 40 point and above. So it was, I remembered, it was chemical engineering. It was anything, chemical engineering. It is, yes, medicine was part of it, but it was all mixed up. There wasn't any direction of some sort, because being the only one that I knew was pilot, but my doctor told me I will never be able to be a pilot due to the ear problem.
The hearing.
So the goal was, I took a mental note and I said, you know what, when I'm working, I'm going to go and do something about the ear. Only for me to be told on my internship year, when I was already saved a lot of my money, I was like, okay, I'm going. And she's like, oh, I think you never got it. You have a genetic hearing problem and it's so neurological. I do not want anyone to ever touch it. So it was like, oh, okay. I thought it was something that can be solved. So when, embarrassingly enough, when I finished matric and I didn't get anything, I got declined in everything. I was sitting at home.
You talk about the application to the various varsities.
All applications were declined. Oh. And so I'm sitting at home and I'm like, okay. So my mom is like, go and do something. Just do something, you know, because now you love the idea of nursing, psychology, you know, go and do some basic science and then maybe you can apply. I was so stubborn. I was like, no, Ma, I've worked hard to be where I am. It's either medicine or not. And yes, they called me a month later. They had already started and they told me that I was on the waiting list. So some hasn't came, and yes, I'm not ashamed to ever share that actually I went in because some people did not accept to be accepted. And the prize was
maybe they were accepted in another university, right? Because sometimes it happens you get accepted in 2 or 3 universities, and then you pick up one, and then you create an opportunity for somebody else elsewhere. So maybe that was the case.
So thank you to those who didn't accept.
All right. So, Doc, but what was remember you said, ubungazi, you know, whether it's engineering or, you know, medicine or whatever. But when you now said it's medicine or nothing, what was the attraction for you? I know your mom was a nurse, right? Or still a nurse?
My mom is a nurse, and my mom forbid nursing. She was like, Anita, you can see how hard we're working. So, no. And then I said psychology, and she said, at that time, they believed psychologists were never easily hireable. So she was like, no, I don't want you to be jobless. So in my mind, I put it together and I was like, oh, okay, sounds like it's medicine then. And that's it. That it's like I said, for me, I really didn't know. I even still remember being excited to walk in, but I was like, what exactly am I here to do?
All right.
I only had first aid that I had passion for, so that's the only thing that I had. I didn't have anything. It was just, my life has been about, I need to make it. I need to prove that being partially deaf is not going to stop me. So I didn't have a chance to explore.
Yeah, lovely, Doc. So, which varsity accepted you? Was it UKZN or UKZN?
UKZN, Nelson Mandela Medical School.
Okay, beautiful. That's my alma mater. So, in 1989, I finished at that same medical school. So at least we've got something in common there. So when you look at your medical school days, you know, when you look at I think you started in what, 2003 to 2008?
2004 to 2008, yeah.
All right. So you did your first year, second year, third year. How would you describe your varsity days from an academic point first, before we talk about the social life? So, did you have difficulties or you were just cruising? How was that 6 years at medical school?
I wish I was cruising.
I'm asking you in the context of the partial, disability from a hearing point of view.
It was not a cruise for me. It was difficult.
Yeah.
I remembered first year, I actually failed a few subjects, so I had to catch up.
Yeah.
And I remembered that December catching up and thinking I do not want to be left behind.
Yeah.
And when they announced the following year that it's only one student, it was kind of a bit embarrassing to
Yeah.
realize I was the only one who had to do some catching up.
Yeah.
So then I just went again on a mode, study mode, cross nighting. That's it. That was my life.
Yes.
And studying twice as much, writing as many times as possible.
Yeah.
Because the problem was a hearing aid started becoming not a problem per se, but with it, I need to it draw all the sound.
Yes.
So when you're in class, it will literally not just only focus on the professor, it will draw everything. So it became an irritation.
Yes.
And obviously at that time I'm already at a stage where I'm not comfortable with they had one where you could give the professor a device where they could wear it. So then it would directly go to you. But I was no longer in that place. I didn't want anything showing that I've got a hearing problem.
Yeah.
I'm a lip reader now, so I will make my way through it. So it was always studying, cross-nighting, studying, cross-nighting. That was it.
Yeah. And so you still did it in the record period of 6 years?
Yeah, the 5 years, yes.
Yeah,
I
5 years. Yeah.
Yeah, it was 5 years.
Okay. And obviously, you saying you had to work a little bit harder than your contemporaries because of the fact that there was a challenge with hearing. However, with more hard work, you were able to move from year to year and finished within the required time. So, Umama, as the nurse, how did she feel when you got admitted to medical school?
She was happy.
Yeah.
She loves any form of academia.
Yeah.
So I have a trunk in my garage right now of all my medical books.
Yeah.
As in, she made a library for me in my room.
Yeah.
She just went in again, the same goal she has given herself ever since she was told I'm partially deaf.
Yeah.
I will give my child everything she needs. So
Yeah.
I had my own library. Every year, whatever list of books that I needed, I purchased.
Yeah.
So traveling to the library wasn't much.
Yeah.
It was just traveling for extra work and stuff. But she just said, I do not want you on the road. I do not want you in danger. If you need a book, tell me, I'll get it.
Yeah. So you had lots and lots of support and encouragement from your mom, so a lot of your success obviously has to also go to her efforts to make sure that you are as normal as possible. You optimize all opportunities as Pamkwako, right?
Yeah.
And then waqeda medicine. And then how was she when you actually got your degree in 2008?
What did mom say? She said, I cannot believe that I paid all the school fees and bought everything, and the first person she calls is her grandmother.
Did you grow up with your grandmom, Uno?
The thing is, she was overseas during the period, so yes, I was anyway from birth raised by my grandmother, so she was always away working.
Yeah.
But it's because I made a deal, Doctor. I had a deal with God in 2008 in January.
Yeah.
I was like, God, please can I finish? Because I've been always working twice as much.
Yeah.
Please now, this year, can I please finish with the group? I promise you, God, I'm not gonna go to the convoy. I'm
Yeah.
going to go straight into the taxi, go home, and we are going to have praise and worship. I
Yeah.
promise you.
Yeah.
So I kept that promise. So,
Yeah.
yes, the first person to call was my grandmother because I had to tell her that I'm coming home. I'm not celebrating this. I've made it, and that's it.
Yeah.
But they were very happy because they used to always say every time when I failed something, it's like as if it was the end of the world
Yeah.
for me, the way
Yeah.
I used to.
Dokotela,
Yeah.
uthini? Angizwanga phela uqedanga.
Ngithi mina inkinga phela ngithi ngangithi mangifeyila something.
Yeah.
Um uthi umama or my aunties, they used to say the way I used to react
You
ngakhona. It's
react
like as
very
if
negatively.
the world.
Mm.
Can you hear me?
No, I can hear you. I'm listening to you. So then they were very, very happy. The whole family was very happy that you made it. And at what point then did you call mom overseas to say, well, mom, actually, I've got this MPCHP, and yeah. So at what point
No,
did you call her?
I called her immediately after calling my grandmother because actually my mom even made a plan. Her life plan was always around me. She
Yeah,
made sure that that year, December, she's in South Africa.
yeah,
So it was just a matter of just calling, saying, "Hi, I'm Dr. Nzimande," and then the next person. But the fact that she was with my grandmother,
yeah.
it just made it like, didn't I pay the school fees for this woman?
No, but she had a reason to complain. I mean, she worked hard. She had to earn. Was she in the UK or she was in the Middle East,
Saudi Arabia.
Saudi Arabia? All right.
Yes,
So she was
yes.
earning in dollars to make sure that you got the best of the education. So she had a reason and a right to feel a bit jealous. Ukuthi, ufonela ugogo before yet. But anyway, Doc, let's move on. So you did your
Mhm.
internship. Where did you do your internship?
When could I?
Which hospital did you do internship on?
Internship was the Kimberley Provincial Hospital, the
The
actual
Northern
hospital.
Cape.
Yes.
Okay, all right. And the ComServe?
I was in CJM. It was in Mood.
Eh, KZN.
Pardon?
It- Enquthu, angithi Enquthu is a KZN.
Yeah, both the KZN.
All right. And then you became a medical officer. Where were you an MO? When you, that is, I'm looking at 2012 now, the time you were planning to specialize, in which hospital were you?
Actually, I first did 6 months in escort,
Yeah,
and then my medical manager enrolled me into the HIV/AIDS program
yeah,
for the 2-year course.
yeah,
And during that 6 months, I then enrolled to Zimewezinkosi.
yeah,
At that time, it was known Dr. Shoba had a good program to prepare you for your paper one.
yeah.
So then I moved to Zimewezinkosi, only yes for things to hit in December.
Yes. All right. So you mentioned briefly that that's the year 2012 where you went into coma and for 10 days, and then later on you then got diagnosed with bipolar mood disorder. What happened, Doc?
Okay. Doug, it was, I can't remember the date per se, but I remembered I had just came back from Cape Town from a BLS or I can't remember what course, but it was one of those emergency courses.
Yeah.
And I get home, I do everything that you do as a girl, buy groceries, everything. And then I got into my car. How I got my car from Pietermaritzburg to Zimewezinkosi,
Mm.
I don't have a memory of that.
Mm.
Because the voices just took over. But I wasn't even aware. All it was, you're useless. You couldn't give your mother enough money. Look at you. You're just not succeeding in anything. So exactly who are you? And and I wasn't picking up that something is wrong. All I was doing is just driving. And yeah,
These voices, you were hearing people talking to you saying those negative things. You were hearing those voices as
those
you were
voices
driving.
were thoughts.
Oh, were thoughts.
But I still remembered how distinct they were about the current situation that I was in.
Yeah.
And it wasn't even a bad situation. It was just, I think I've always been an overachiever. So if I can't do something for my mother, I react.
Yeah.
So by the time I got to Zimewezinkosi, my mind had already structured what's gonna happen.
Yeah.
Do you remember when you were a kid? You tried to kill yourself using then I found out later it was doxycycline.
Yeah.
Do you remember when you were a kid, you also tried Panado and then you started vomiting? So now you're gonna get into the house, you're gonna take all your sleeping tablets, you're gonna put them in a glass and you're gonna put warm water and you're gonna let them dissolve. Because you know why? We don't want you to vomit.
Yeah.
We want this to work. So I get it. And my mind is functioning. Okay. So it's already made its mind. I'm dying. Today is the day I'm gonna die.
Yeah.
Your policies, where are they? Okay, they are here. Just take them, put them on the desk. How are you gonna park the car? Park your car in reverse so that it's easy for your brother to take it out. Do not lock the door. Um, don't make it difficult for your family to access you. Got into the house, carried out the instructions. I still remember it was a yellow fluid that I mixed up. And yes, it was all combinations from sleeping tablet, Allergex, anything that I knew had a neurological effect. And so I took it. Everything, put my papers in place, and I went into bed. I switched on the television. I played my cartoons since I love them. And I don't know what happened after that. All I know is that I was told that I made phone calls.
Yeah.
I called my mother and I cried and I said it's done. I called my then boyfriend then, and that my then boyfriend came in and he thought that I meant that I took sleeping tablets, so I'm going to sleep, but he couldn't understand the part of crying.
Yeah.
So he made it a point to sit there and observe me. And apparently he said I slept through the whole night, but something told him to not sleep. He must just watch me.
Yeah.
And then he said I did the strangest thing, woke up in the morning, phoned my mother again. Mom, it's done. I'm done. I'm sick and tired. I'm just thinking.
Okay.
Then he said I walked into the bathroom and I locked the bathroom.
Yeah.
First of all, I'm not a person who locks the bathroom. I'm allergic to even closing the bathroom. So it's like, okay. Then apparently I came out with white powder on my face.
Yeah.
Apparently I took a blue death that end powder.
Gabon. Yeah. Yeah. Yeah.
Yeah. So apparently I added on top of that.
Yeah.
And then I got out, look at him, collapsed.
Yeah.
And
So
he said, I just asked you one question.
yeah.
Zim, are you okay? Should I call your medical manager? She said he only did that because she knew, which I'm too private. I don't want anyone to know anything about me. She said the minute I didn't respond, she knew something was wrong.
Yeah. 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 So
And
imagine Yeah. Now, I don't want us to go further in terms of the detail, but before all of this, there was nothing. You didn't have any issues of depression or symptoms of depression. You didn't have any symptoms of, emania, or there were certain things that already before this incident, bezikade zikhona.
None that I saw. I only
Yeah.
saw them when I was sitting in the couch with my psychologist.
Yeah.
One is childhood tendency of committing suicide.
Yeah.
Also at work during my concert,
Yeah.
they noticed I would have a very high drive. Like I would attend to 2 wards and then go to OPD, and I would do that for like 3-4 days.
Yeah.
And and then I would collapse and phone in and say, you know what, I'm not feeling well, I'm sick. So they
Yeah.
noticed a pattern. They told my mother. My mother, I think at that time wasn't ready to face that there is a problem.
Yeah.
So
Yeah.
the only thing that I was doing during my working time was working because I had a lot of energy,
Yeah.
and then collapsing and just calling it, I'm sick, it's a flu, I'm tired.
Yeah.
That's it. There
Okay.
wasn't anything. But I only
All right.
noticed that when we started talking with the
Yes. Yes.
psychologist.
Yeah. All right. So, Doc, after you had taken that concoction and adding blue death, then you obviously collapsed and you were taken for stabilization and being treated. And after 10 days, you were out of the situation. And obviously, then somebody had to sit down with you and break it all down, Uguti, kwenzakalani, and all of that.
Yeah.
Yeah. And Umama, was she here or she was still in Saudi that time?
No, she was already back.
Yeah.
Um, at that time, yes, she was already more in South Africa than overseas.
Yes, yes, yes.
And she was there,
All right.
helping
Uh,
through it.
yeah. So, did they say which type, of the bipolar? Did type 1, type 2?
It was a juggle. The only thing about mental illness is that it's not always a first diagnosis.
Yeah.
I went through being said it was depression.
Yeah.
Then it was, yes, bipolar. Then all of a sudden I'm hearing borderline personality disorder.
Yeah.
Only time it was sealed is when I came back with information that actually on my father's side there's
Yes.
bipolar.
Yes.
So he said, no, I just have the mild form. It was bipolar disorder 1.
Yes, 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 yes. Just for the purpose of the viewers, bipolar mood disorder, it's basically a mental disorder where you've got extreme mood swings, which may occur rarely or sometimes multiple times a year, and the person is fluctuating, from extreme happiness to extreme sadness. Extreme sadness, that's what they call depression, and then extreme happiness. There's 2 levels. It could be what they call hypomania, or can be a full-blown mania, where you are extremely, extremely, happy, and you're full of energy. You are euphoric, you are sometimes irritable, and sometimes these mood swings can affect sleep, energy, your activity, judgment, behavior, and sometimes the ability to think clearly. So I thought, let me just break it down like that. And type 1, lo okhuluma ngaye, is the one that tends to have the manic episodes. That is, the full-blown extreme happiness, which may be preceded or followed by the lower version of happiness, which is hypomania or major depression. Whilst type 2 doesn't have a full-blown mania. It is what we call hypomania, and also depressive episodes. So you were diagnosed with type 1, but this is after they had thought it was major depression at the beginning. And then, they were thinking maybe it is bipolar. But the important thing here is that bipolar is a lifelong mental illness, and it tends to have a hereditary, a connection, a genetic a connection, especially from first, first generation. If somebody like your parent had it, then there's a higher chance that you may have it, as well. All right. So I thought let me just clear that up so that people understand what we are talking about. And in fact, just a little bit about mania. Somebody is abnormally upbeat, increased activity, energy, or agitation, exaggerated sense of well-being and self-confidence, which we call euphoria, decreased need for sleep, unusually talkative, racing thoughts, that is, the brain is firing on all cylinders, distractibility, sometimes poor decision making, somebody going on buying sprees or taking certain, risks that, on hindsight, they should not have, taken. So I thought I needed to just clear that so that people understand what we are talking about. Now, so Doc, when you got diagnosed, eventually, how did you take the decision? Sorry, the diagnosis.
That waking up from a coma.
Yeah.
The coma story has its own adventure on its own.
Yeah.
I thought, yeah, it has its own thingy, and it's scary enough. Like if I were to share that part in the order, so I had this. I need to know what's going on, and luckily I had the best of the psychologist and a psychiatrist at that time, and I just sat there and I just took all the information in. And my psychologist was good at making me see that it's not a now problem. It's been there since I was a teenager.
Yes.
And for me, it's scary enough. It was like, you know what? I need to do something about this, and I need to just take my treatment. So taking treatment for me wasn't the hardest part.
Yeah.
It was easy because I was scared of what I have just came out of.
Yes.
And also being given the information in conjunction to your life. I remembered one time he would say, you're driving powerful cars and you literally can cover distances in less than an hour than the supposed time. And you don't see anything abnormal about that.
Yeah.
Is one of your manic phases. The fact that you would just pitch up in Johannesburg and say, no, Doc, I'm just here to give you a cake. It's your birthday. Happy birthday. Bye-bye, and leave.
Yeah.
So he would use everything that he knew about me after letting me talk for about 2 to 3 sessions to say this is what, as in all the symptoms you were talking about. So I knew I had to do something. But when I kept trying, the problem was I couldn't grasp it. It's like I would take the treatment, but I wouldn't pick up what were the triggers.
Yeah.
And so by the time, so it was 2012, 2013, 2014, it's only 2014 when I've always been admitted in Tabeni and doing all the sessions. You do time management, you do sessions on how to monitor yourself. They would say, have your own temperature, know when you're happy and too happy. And because they would say, for me, it was like, remember when you're too happy, you drop. So you need to monitor that. And I wouldn't grasp it, like I wouldn't, until one day he sat down with me and he said, your triggers are your career itself, because you channel all your energy to work and you're okay with the idea of not sleeping.
Yeah.
And your triggers are relationships.
Yeah.
So I then had to make a decision. That's why he said to me, you have to choose between doing this neurology specialty one day and die in the course of trying to be one, or it's time to change your direction. And it wasn't the nicest. I remembered going into my car and I'm thinking, he's wrong, he's not right. But I could hear it. Choose life or choose to die. So I had to take a step back. Unfortunately, when I get back to work in 2014, my consultant felt I'm not dealing with it. And so he wanted to put me in an employer assistant program. But the way he displayed the information, it came as I'm being attacked. It came as this guy doesn't want me to work. Does he even understand that I need to do my calls so that I can survive for everything that I owe?
Yeah.
So he's being a bad person. So I quickly thinking, because I was like, so long as my psychiatrist hasn't written any report that I'm not able to work, who is he to say that? So I quit. I literally left the Department of Health. I resigned with immediate effect with no plans, and I went home and I was like, I'm sorry, I've already suffered enough. And right now, hearing to me, it was a lay person telling me that I cannot function like other doctors. I'm not dealing with it. And I'm thinking, do you know how long have I been living in Tabeni Hospital dealing with this? And do you know how many changes I've made in my life dealing with this? And you come and tell me I cannot be a doctor. You come and tell me I cannot work full time. No, it's fine. Take your job, keep it, I'm gone. And I left.
Yeah. So you actually felt it was part of, some form of discrimination or stigmatization just because somebody knows your diagnosis.
It felt like that.
Yes. And you then decided, I'm out of here. You went back home.
There were so many other professional doctors I've seen being attacked about this. I didn't want to lose my practice number. I didn't.
Yeah.
And so for me, it was better to save it by quitting
Yeah.
without any further plan than to go through, because he didn't lay it well. In fact, many years later, he did call and he did explain to me that he himself saw the triggers and all he wanted was to help me lessen the workload at work so that I can still deal with it. But you can see that he didn't put it in a way that it would sit well with you.
Yeah. I think it was an issue of communication because as an employer, when one of your, employees, or if you're a manager, when one of your subordinates has an illness, physical or mental, once you understand the nature and the severity of that problem, then there is a duty on the employer to reasonably accommodate that person. And reasonable accommodation, obviously, it depends on the job, responsibilities, mental and physical. And usually, occupational therapists are the people who are best placed to actually do that job matching, looking at your residual function and looking at your job demands and advise the employer on how best to reasonably accommodate you so that the work doesn't become too much for you. And also the referral to an EAP program, which is an employee assistance program, which is the counseling or psychosocial counseling services by social workers, usually clinical social workers or psychologists. It's also part of the support program. I maybe suppose the tact to actually communicate that left a lot to be desired, and it ended up in a negative way, in the way that you took it. But I mean, for him to come back years later, to actually come back and try to explain that this is what I was trying to do, at least, uno numbers, because other people would never, do something like that. Many people have been destroyed by managers who did not communicate well, and adverse outcomes come out of that situation. But anyway, so wahlala ekhaya, and then mawuhlala ekhaya umama wathini ke manje?
My mom is that type of person who says, I've prayed to God, akwenzeke okufanele kwenzeke.
Yeah.
So he just said it's fine. Sit.
Yeah.
You will figure yourself out. I know you.
Yeah.
And so I actually stayed at home for 2 months.
Yeah.
And then I came across the NHI project.
Yeah.
And then I remembered what my psychologist said. It's time to downgrade your life, including your professional. So I was like, oh, okay, it's clinics, it's 8 to 4, there's no calls, there's no weekends. Perfect. So I went into that direction.
Yeah. Yeah. All right. And how did you cope there?
It was amazing. I fell in love with the actual program, HIV/AIDS, and I had a very good manager who pushed me now in the direction of managing clinics.
Yeah.
And yeah, there was a lot of exposure about HIV/AIDS, from counseling to not just being a doctor that test and give treatment. Now how to help the patient and everything. I fell in love with the whole program, that I would go an extra mile, and I just love managing patients, but I also love managing the system itself, so that my patient could get better, so that my patient could get access to treatment and everything. So I didn't actually realize I'm already moving into the management side of it. So I fell in love with policies and guidelines and everything during that time.
Yeah, beautiful. And in a way, that was some form of reasonable accommodation, because had you stayed where you were, I mean, okay, I'm just saying it. This is what should have been done, when you were in the other place, where they would cut down your number of hours, try to manage the workload, and all of that. But obviously, it took you resigning and getting another job, and actually finding a perfect job that would enable you to have, some balance, and also, allow you, sometimes we talk about, we think we're being rejected, but actually we're being redirected, from one situation to the other. So that decision you took, to say, I'm done with this hospital, 2 months at home, and getting the opportunity, of a job that would ultimately channel you towards a different line, while still applying your medical knowledge. I mean, this, if you are a believer, you'll then know that there was God out there, who was looking after you. I mean, you say your mom is somebody of faith, and she said you'll figure things out, but she kept on praying for you, and God delivered, and you got your perfect job, and a meaningful job for that matter. So how long did you stay then in that HIV, management program?
I stayed up until 2018, and then the whole program stopped. So because my whole life was already happy there, I didn't have any future plans. So I was only unemployed for about 6 months.
Yeah.
And before then, I became a clinical manager in CJM in Motu.
Yeah.
And it was clinical manager for the HIV/AIDS program itself.
Yeah. So very similar to what you were doing before.
Very.
Just at a higher level, manager, you were managing people who were doing, the work.
Yes, and being a right-hand man to your medical manager,
Yeah,
it was just a bliss for me. It was like, I love doing this. So long as I'm solving problems and so long as I'm making it easy for patient to get it. And
yeah,
for me, I thrive on having patient where they come in a certain way, and
yeah,
by the time 3 months is over, you can see the future, you can see the light,
yeah,
and I thrived on that.
yeah, yeah. But also, working on the system within which others are working, improving the system, which is something that we're not taught at medical school. They were taught how to deal with our patients, how to give optimal treatment, monitor, and all of that. So there you were, already been introduced into the system within which we are working, and you were enjoying it. And so, how was it from 2018 up to, the latest job as the right hand person to your medical manager?
It had its challenges,
Yeah,
um, but the challenges were met by a girl who would say, I'm not gonna cry, I'm not gonna break,
yeah,
I want this.
yeah,
The only funny thing was 2019 December when I was acting because my boss had to go on leave.
yeah,
And at that very same time, he got news that his father passed on. So I knew now the period is going to be longer.
yeah,
And the one thing about being bipolar, you always want to be prepared. So December was no plans for me, social plans.
yeah,
I need to be at work. I need to always wake up fresh. I need to have everything here, all my documents diarized. I mean, my hand would have notes
yeah,
because, you're trying to remember everything. And most of all, the biggest goal was I do not want to disappoint my medical manager.
yeah,
So when December hit, I was like, yo, I'll never be a medical manager. It's difficult to manage our own colleagues, and especially because they were older than me. They were not being difficult intentionally. It was just normal way of life.
yeah,
And but when I went in January for meetings and now sitting in boardrooms and doing this, my love was like, oh man, guys, I'm not into clinical anymore. I'm loving the boardroom.
yeah.
I'm loving
Hey,
you know I love it. So and I remembered, I was like, you know what, I would love to do this one day.
yeah,
And not knowing that a mentor of mine would actually recommend me.
hey,
So when I got the post as medical, it was more of I was recommended. And I just somehow felt like this is it. This is what I've been prepared for. Anyway, my medical manager, when I arrived in 2018 September, did say, I want you to grow to a point that you take my position.
that's a good leader. A leader,
So he literally channeled me there.
a leader who develops others, a leader that's prepared for a situation whereby the subordinate can take over their job one day. That's a good leader. Not a leader who is threatened by your ambition, not a leader that's threatened by your success. So whoever that leader was, Bengzoti give him a bells, but now as a doctor, I can't recommend bells. That's an alcoholic beverage. So, but kudos to that medical manager of yours, because the success of leadership is to actually develop a pipeline of other leaders behind you to a point where one of them can take over your job. And that to me is leadership. And it's something that does not happen automatically. It needs a certain type of a leader to actually be a leader who nurtures, who develops, who supports, those that come, after him. Is a him or her?
It's a he. That's a Bibelu.
Okay.
It's a him.
Yes, beautiful. That's the type of leadership that is required, and I wish more people would understand that being a leader means developing others, creating opportunities for others. It is not about using the power you have over others to make their lives a misery. It's about empowering others. Leadership in the 21st century is about empowerment of others, giving direction, ensuring that people reach their optimum in terms of their potential, not frustrate people so that you can feel your power over them. So I just wanted to emphasize that. But obviously, getting into this medical management role now, there's more management responsibilities that come with the role. And I've been seeing you on your Facebook page. You've been buying strategy books. You've been reading biographies, like my big brother's biography, you even went to his launch at Howard College, just to meet him. So what is the attraction to the world of leadership and management?
What is the what?
What is the attraction kuwe? Yini oyenjoyayo? Now that you've tasted being a leader, you've tasted being a manager. During that December, you were in charge of people. Obviously, you had a bit of challenge because some of your people that you were leading were not cooperating. Some of them that shouldn't tell them what they must do, but you were there on merit and you had to do what you had to do. But I'm just saying, after you tasted that, you actually thought, I'm enjoying this, I'm enjoying this. And so my question then is, now that you are no longer just focusing on clinical stuff, but you are more of leading, managing, looking at systems, how to improve them. What gives you a kick as a manager?
That many years ago, someone said leaders die. And he used an acronym saying, as an acronym, he says, leaders must dream, implement, and exit.
Yeah.
And for me, I always remember that. Dream, implement, exit. Don't stay.
Yeah.
And don't overstay your welcome. So whenever I do things, I always look out for how to make my subordinate life easier, how to encourage them to dream more than what I found them to be. And most of all, delegation.
Yes.
And I find that one very fascinating. I actually did a course, Women in Leadership, in the beginning of this year, online Stellenbosch. And you get to learn things like that. You get to learn the glass ceiling. You get to learn all the things about gender gaps and all the biasness that happens. And you start to realize that we define leadership as male. A leader is male. We never, even when we define it, he has to be strong, assertive, resilient. And then when you take the same things and put it on a female, you say she is forceful.
Yeah.
Why must it be negative when it's a female?
Yeah.
And luckily, my CEO is a female, and she's also having the same thing, preparing me for the next level. And for me, she keeps emphasizing working hard, putting things in order in the very beginning. Do not accommodate what do you call it? Staff members that tend to slack, because if you keep accommodating, the ones that are working hard soon will lose their their enthusiasm.
Yeah.
Straighten them up in the beginning. Let them know who you are, how you lead, and also learn them. I spent like I was lucky. I arrived during COVID. So I
Yeah.
spent the whole COVID season knowing them, how they have been working. And
Yeah.
I would have this thing of telling them, guys, I don't correct what is not broken.
Yeah.
I correct what is now broken in my capacity, but
Yeah.
we will work together. I'm not a dictator type of leader.
Yeah.
I'd rather we discuss things, but there will be instances where I want certain things done because it has to be done.
Yes.
And so for me, through my CEO, my current CEO, it was being able to make the doctor's work environment better, being
Yeah.
able to make the allies who are under me better,
Yes.
and also sorting out those little things that actually does affect others. At the end of the day, if you always accommodate a bad apple,
Yeah.
believe me, your good apple will soon say, you know what, I'm tired, doc, I can't come to work. Not that they sick. They're just
Yeah.
tired of you entertaining wrong people all the time.
Yes.
So I love that about leadership. You go and solve the problem with
Yeah.
them. You're not bossy. You
Mm.
solve it with them. You
Yes.
sit and talk with them.
Yeah.
And I'm learning every day. I always make sure that I'm open to learning.
Yeah.
And luckily, my CEO's door policy it always open. So I do go there. How do I handle this?
Yeah.
And he's always putting me next to her in meetings, so I get to learn how she thinks,
Yeah.
how she solves problems. So on times when she's away, I always ask myself, how would my CEO do this? How would she solve this?
Yes.
So for me, I'm just fascinating about solving problems.
Yeah.
Hence, I'm hoping in future I'll be doing my public management
Oh,
course.
you've made the decision. I remember about a month or so,
Yes,
you were saying MBA or public management. So you've made the decision now.
yes, I have.
Lovely, lovely, lovely. So now I'm looking at the shelf behind you, and I'm seeing a book. I think it's the number 2 book from the extreme end. Please take that book. Yes, from that end. I see a black book there. That one. And then we keep. All right.
My
Oh,
favorite
okay. Yes, 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 yes. Is that the one that's got what do you call this thing now? Is that the one that has got uh, autograph or something like that?
No, this is one of the other copies.
Yeah,
Um, the one thing your brother said
yeah,
in the meeting in early before I started my new job was
yeah,
any black person given a chance can actually do it, can
yes,
actually work anywhere.
yeah,
It's just about giving them a chance,
yes.
a same chance as the other races, they can do it.
Mm,
And that's what I needed that day.
yeah. All you need is to be given an opportunity and you rise to the occasion.
That's it.
Yes,
And I love the fact that he actually said that there isn't actually monopoly the way we always believe there is.
yeah,
Maybe we're making it in our mind. We've been giving white people too much credit.
yeah,
And hence when you give them too much credit, they become this huge mountain in front of you. And
yeah,
so you think you can't do it. But actually when you give them a chance, and that's what I've seen.
yeah,
My CEO gave me a chance this year.
yeah,
And and I'm surprised at the rate that I'm growing.
yeah.
And I'm not scared to walk into boardrooms. I'm not scared anymore
Yes,
to be an acting CEO and go to the meeting that she would attend. because she gave me that chance. And it wasn't about how old I am. And yes, I do acknowledge it. In fact, I always say to my CEO, the only weakness I have is if anyone says to me, "Uyingane," then I'm like, what do you want me to do? I know ngiyingane.
Yeah.
But I didn't come here as ingane. I came here as my position, and I am respectful. Let's do the work.
Yeah. And those who are under your responsibility, your subordinates,
Mm-hmm.
do they love you as a leader?
I hope so. I hope so. I hope
Okay.
so.
Yes.
It wasn't easy. It wasn't easy because they were predominantly females.
Yeah.
Um, and their previous medical manager was male.
Yeah.
So I wondered if the dynamic that we've always been knowing that, females respond better to male leadership.
Yeah.
Did it play a role? Um, but I decided that, you know what, I have done this course for a reason, and it seemed to have come at the right time.
Yeah.
So I'm not here as a male or female. The fact is, I am just here as a medical manager, yes, who is a female. So
Yeah.
I'm going to fight my battle like a girl. I'm not going to fight them like a man. I'm not going to wear shoes like a man. I'm going to fight them wearing my heels. And until we get to know each other, get to understand each other, let's make it work. And I've watched them flourish. I've watched them do the work. I mean, I was blessed to have a very professional group of doctors,
Yeah.
blessed to have a group of allies that are professional. They actually don't even need me to be there.
Yeah.
They know exactly what they need to do. They know
Yeah.
exactly what they're not supposed to do.
Yeah.
And it makes life easier. But those challenges, they come here and there.
Yeah.
Yeah.
Beautiful. And then COVID came, and that's the time we laphayana. So,
Mm.
are there any high points or low points about leading during the time of COVID?
High point was for me, the CEO would say, "Mabhalane yena."
Yes.
So he has created his own jog team. So I would have the moment times when I would have to run them, but was picking up that actually as a doctor here, this is not a doctor problem.
Yeah.
Yeah, IPC is more important than me and my matron. This is the
Imangani.
person
What is
who
IPC? What's
IPC is
IPC?
our infection control
Okay.
officer.
Yeah. Yes. Yes. Okay.
Yes. And quality assurance. In fact, I would always admit it in a meeting, guys. These are the two people who knows about this, how to control it and how to put the policies in place. I'm giving it to them.
Yeah.
We are just going to support where it was needed.
Yes.
And it worked.
Mm.
Um, and it taught me that sometimes there will be instances as a doctor you just don't know.
Yeah.
And really, with COVID, we didn't know.
Yeah.
And management section, we had challenges. We experienced challenges that took training from the mental team, the psychiatrist,
Mm.
to come in now and teach us about mental health in
Yes.
relation to COVID.
Yes.
Teach us that staff members are scared.
Mm.
Not that they are being disrespectful, they don't want to work, they are scared of the
Yes.
unknown.
Yes.
So,
Yes.
as managers, you need to take a step back and look. Have you noticed that the symptoms of COVID are similar to the symptoms of anxiety?
Mm.
And that's when it started to make sense.
Mm.
The lows, we didn't have lows in our clinic. We didn't lose a staff member.
Yeah.
But the lows were just the fact that we didn't know what is COVID, how
Yeah.
long it's gonna be. We would have, you leave on Friday, have implemented something.
Yeah.
By the time on Monday you come back, you realize what you implemented last week is so outdated. You need to start again.
Yes.
It
Yes.
was
Yes.
moving so fast.
Yeah.
So those were the lows, but they were more like learning lows. You would
Yeah.
learn, get
Yeah.
up and pick up yourself. So we had to remind the team, we had to remind staff members, we ourselves are learning. We ourselves are going to go to the thinking board. We're gonna write, and then we're still gonna erase. We're gonna
Yeah.
write something else. We still, and it made, yes, certain people not believe that we knew what we were doing.
Yeah. Yes.
But
But I mean,
one of the things
it's a
about,
pandemic. The pandemic. There hasn't been a major pandemic like that since 1918, which is 102 years ago. So, it was important that everyone understands you are on a learning curve. Yes, some people have got expertise on things like infection control. Other people have got expertise on quality management. And you bring all of those people. In fact, again, you being a leader, they always say leading knowledge workers, it's a different type of leading. They don't need somebody who's going to lead them like Kusefik. You give them
Mhm.
space, you give them support, and where you find that they've got gaps, you look at how to close those gaps, but you respect them because your success,
It's
is
dependent.
so much dependent on them, being motivated, being inspired. Your job is to give them direction, in spite of the fact that there may not always be clear, a way forward. But your job as a leader, your job as a manager, is to sit down with your CEO, and also talk to other leaders of other hospitals or even the province,
Yeah,
to be able to say, this challenge, nina nilungise kanjani, meaning being able to talk to others, especially those who may have experienced a similar challenge, so that you can then be able to say, how can I use that in our own environment? It may not be a cut and paste, but at least it will go a long way towards actually helping you to solve your own problem.
true. In fact, I remembered one call. I made a call to the CEO in Gosi Albert Luchuli, Dr. Kanile,
Yes.
and I was like, please help me out in this situation. It had to do with how will patient maneuver around in terms of X-ray.
Yeah.
And imagine taking her advice and trying putting it in a CAC.
Right.
But the way she was ready to help,
Yeah.
it really made me realize how much we needed to be transparent. So one of the things that we had to do was share all the information
Yeah.
about COVID. And
Yeah.
then, but at the same time, be moderate. Like I would tell my team, guys, don't have this habit of getting home and listening to every single information, because some information are more social based and
Yeah.
they will affect you.
Yeah.
Just strive to know your medical information, strive to know how to protect your family, because
Yeah.
I need your family healthy now so that you also can still function at work.
Yeah.
And then let's strive to help one another. This is the season where I want to see both the allies and the doctors merging. I want to
Yes.
see them. I don't want to hear that you guys didn't help each other. So physio had to be up to date, occupational had to be up to date. And I say, if a staff member walks in and needs help, help.
Yeah.
Don't be thinking, no, you have to go there. Help and move them to the next level, because right now there's too many dynamics involved. Finances are involved.
Yes.
Um, the mental aspect is involved. So
Yeah.
we are here to be a team together. But I learned about transparency.
Yeah.
Share information. Don't hide anything from your subordinate. Don't hide it. At that time, we needed to just share.
Yeah. Doc, we are going towards closing now our discussion. But I'm looking at the Facebook page. You've got so much love that is being demonstrated on the Facebook page. Umis Tulisile Mhlungu, a wife to one of our colleagues in Durban, who's also a mental, health advocate. She's a lawyer by profession. She's saying the beautiful bipolar mind. All right. You've also got Dr. Nozuko Mkabai. I know you guys and Nozuko, you share a lot of information together. She was my guest just 2 days ago, and she's saying, I think this one I must start with. Why is there no love, Dr. Nyati? She's absolutely gorgeosity. So that's what Dr. Mkabai is saying to you. She's actually saying, you go, girl. No acting CEO. And she's saying, oh, you look stunning, baby girl. Dr. Prudence Mutelezi, your product. And Tulisile Mhlungu again says, I am inspired by this young lady. And then you've got also Leroy Makopeni who's saying, happy birthday to Inkosazana. Her story is inspiring. You've got Dr. and Dokozo Sheli Tambuza, Dr. PhD from the Nelson Mandela Metropolitan University in PE. She's saying, happy birthday, Dr. Nzimande. Umpomatu is also, sending some love. So really, you have got so many people who are just so inspired by your story, Dr. Nzimande. And I think as much as you were saying before the interview, you got some butterflies just before we went live, asking yourself, why did I consent to this thing? But your story has actually, inspired many people to say the fact that you have a diagnosis, a lifelong diagnosis like a bipolar mood disorder, does not mean you cannot be able to work in a responsible job position and actually add value to the quality of the lives of other human beings. And yes, it might have been a bit upsetting when you felt like you were being victimized, but actually I always say you were being redirected to where you will thrive most. And it seems to me that in the role that you are playing, you are thriving, and you already have a vision of, I need to be the CEO, but before I get there, I need to empower myself with skills, but also learn, get somebody to mentor me, get somebody, to coach me. And it seems like your CEO is doing exactly that, mentoring you, coaching you, so that at a certain point, you could actually be the CEO of the hospital that you are in. So I thought I needed to just, share that kind of information to basically say so many people are inspired. There's also another colleague of mine, but she didn't leave any message. But she is an expert on matters of incapacity and disability. She's an occupational therapist, one of the people who support this program, Miss Ritabile Matolweni. She really is an expert on matters of incapacity and disability, especially vocational type of incapacity and disability. And one of these days, I'm gonna be inviting her to talk around issues of reasonable accommodation of medical doctors, who may have some challenges from a cognitive point of view. How do you reasonably accommodate, those kind of people? So you really have a lot of people who are listening, who are inspired. But Singakuluma, doctor, it's your birthday, so I'm sure you still need to go and spend time with some people. Lapo Ekaya, and also get some rest. Do you want me to share about your secret or in Tulengai, the 36 thingy?
Doug, thank you very much. Please don't stop doing what you're doing. It's very quite impactful.
Yeah.
The thing is, mental illness is not as scary as we tend to make it, but it does require a place, a bigger heart, and a bigger environment where people are going to try and understand.
Yeah.
And I always say this: some people are going to be scared of you. It's okay. Let them be scared, because whatever they understand, to them it's just too much to Lokunjam. And let them go in peace. Don't force people to be in your life. Because kuyasabisa to even date a woman whom you know you might come home and who's already trying to kill herself. It's scary. So if you pick up those things from friends and partners and family, let them go in peace, take a step back, stay in your own environment, be happy with the little that you do, just to wake up in the morning, breathe in, breathe out, and live. Don't try to be something that you're not. Don't also try to be something that you cannot, if it's gonna cause you to kill yourself. So I'm content with my routine life. I'm actually content about the fact that it's 7:30. It's time for me to actually take my medication. And I'm okay with the fact that I sleep early. So yeah, please don't stop that. You've created a very wonderful platform, and thank you for inviting me. I truly appreciate it. Now I'll call it the highlight of my 35th birthday. I don't mind sharing my age, by the way. It's the highlight of my 35th birthday.
Lovely, 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 lovely talk. So you have not answered me though. You in less than a month from now, you'll have a new role, that of being a mother.
Yes.
Right? Are you looking forward to that?
Oh yes, definitely.
Yeah.
Yeah, I'm practically now excited about that. So 3 days from now, I'll be starting.
Oh no, what happened there now? We were still
My maternity leave. So
yeah.
sorry, not a good idea to be a mom because I've got bipolar.
Yeah.
But now I don't know. My heart is just telling me this is a new adventure.
Yeah.
Bring it on.
Yeah. Beautiful. Beautiful. Dorothea, thank you very much for entrusting us with your story. For those people who did not manage to get time to watch, I will send you your YouTube link to this conversation, and then you can also just watch it at when you've got time, and share it with your mom or whoever else, so that they can see how well you were able to share your story with the rest of the world. And that is just part of your healing. That's part of inspiring the rest of the world, because we've got viewers not only within this country, the rest of the continent, and also outside, the US, the UK. So it's always good to actually give people the platform to share their stories, because storytelling is one of the best ways that we can learn. And it's always been like that in this continent of Africa. Different generations will share stories with the next generation, and that's how we have been. But okay, that story, sharing thing has also been a weakness, because we have not put things in writing. And some people from other continents, they come to this continent and think that we did not have brains, we did not have inventions of this and that, only because we didn't always document things. But in the digital world, you've shared your story, it's now gonna be available on YouTube. Even in 100 years from now, you can retrieve, well, not you, but your children and their grandchildren can retrieve this interview and know how beautiful a mind you were, when you were going through this interview. So thank you so much. But also thank you to your mom for not giving up on you, for giving you all the opportunities, and pushing you. And right now, you look back with gratitude, not only to your mom, but to your God as well. So thank you very much. All the best with your maternity leave, and all the best with the little one who will be coming in less than a month, and enjoy the new journey of being a mom. With
Thank
those
you.
words, I want to say thank you. And also to all our viewers who connected here, I also want to say thank you for connecting with us. I enjoyed listening to the story of Dr. Nzimande, and I hope you did as well. So thank you very much. Thank you.
Thank you.
All right. Yeah.